still get the benefit of chiropractic when they are in the womb, because when we're adjusting mom when she's pregnant, we are impacting her nervous system, and baby's nervous system directly develops off of that.
So kind of going a little bit further into traumatic births, what are some of the effects that traumatic births can have on babies and mothers?
When you have a baby, they kind of run the house, right? And so if you have a baby that's having issues because of a traumatic birth, and again, you might not know that that's the reason, because we're kind of trained to believe like, oh, well, I'm just unlucky because I got this kid that doesn't sleep through the night, or I got this kid that won't feed, and it's like, those aren't, like, you're dealt the entire deck, and the cards that you picked were like have to do with this traumatic birth, and you don't even know that. And so I think just like the general feeling of helplessness is really how it can affect the mother, because I've talked to a lot of women who have babies that have colic. So colic is like, it's different than a baby just crying. Like, this is like blood curdling, screaming, and you can tell that this baby is in pain, and they're like, the moms are like, there's nothing I can do. I don't know what to do. Like, I can't help my baby. And so they feel like they are not doing their job as a mom. And so that can just put so much stress on them and really contribute to postpartum depression and baby blues, which is a thing that happens too. It's not as severe as postpartum depression. But the feeling like I'm not doing as much as I can for my kid, I think is really how it affects moms. And some other effects that traumatic births can have are, we did kind of touch on it briefly, but breastfeeding issues is a really, really big one. And I'm super happy that breastfeeding is becoming more normalized as well. We still have some work to do. Like, there is still some backlash that women get from breastfeeding in public, but it's like, that is what they're for. I don't like, they're, that's a whole other issue. But there are so many benefits to the baby being able to breastfeed, not just from getting breast milk, but from the actual physiology of breastfeeding. So it helps their head form the way that it's supposed to, because there's this like negative suction when the baby is drinking directly from the breast. The mother's breast milk is made specifically for that baby, because the mom, like, she'll like kiss her baby's head, and it's like, oh, well, they have some of these things like on the surface of their skin, and they might be trying to fight off this infection. So I'm going to make more antibodies in my milk. And when a mom is trying so hard to breastfeed and is working with a lactation consultant, and they're just like, we can't figure out what's going on with this latch, it's because babies don't have a lot of jobs in life, and they need to be able to like eat, sleep, poop, and grow. And if so one of those things is being interfered with, it's a pretty good indication that there was birth trauma that's contributing to neurological interference. What chiropractic is able to do is retrain those nerves. So if you have a baby that's 4 months old and they're like chewing to try and get milk out, super uncomfortable for mom too. And it's like, you can try and fix the latch, but their brain is like, well, this is the way that I've always gotten milk. So we need to break down those old pathways and reestablish new appropriate ones. Some of the other things that can happen with mom is maternal stress levels really go up when all of this is going on. And there was a study done that says that the stress that mom is experiencing actually affects the development of baby, which is like kind of crazy, but it's like, you don't, like, babies can feel things that, because they can't use their verbal communication like we can. And so they can just like pick up on their mom being super stressed, and then they almost go into a stress state too. So again, it's that feedback, and being able to just make baby happy makes everybody a lot happier.
I saw you also had a really interesting post where you talked about spine trauma on infants during induction. So can you elaborate a little bit more on this?
Yeah, so that kind of goes back to induction happening really before the mom's body is ready. So the exact moment of conception usually isn't perfectly known by mom or dad or doctor. And so the due date is really estimated. And so if we think that they're at 40 weeks, but maybe mom's at 39 weeks and baby's just not ready to come out, then what the induction process can do is try and force them before they're ready, and then they can end up stuck in the canal. So you have this thing called failure to progress in labor, and that's one of the big components of C-section. So not only do you have the baby being lifted out of the canal this way, which we talked about earlier, but they're like already further down in the canal. So there's more work to do to get them out. And they have the increased stress of being stuck in the birth canal and not being able to go anywhere.
Interesting. So how early would you recommend someone bringing in their baby for you to look at?
The youngest I've seen was 12 hours old. So the second they come out is when we can see them. And again, even before that, in pregnancy, they still get the benefit of chiropractic when they are in the womb, because when we're adjusting mom when she's pregnant, we are impacting her nervous system, and baby's nervous system directly develops off of that. So they're still getting the benefit of having a clear nervous system before they're even born. But when they are joining us earthside, as soon as you want. I would recommend going to somebody that is trained in pediatrics, because the way that we adjust babies is different than the way that we adjust adults. So chiropractors sometimes get this negative backlash for adjusting babies because people think of it as, well, you're going to be cranking and cracking this baby's neck. That's not how it happens at all. The last baby that I saw this week, he slept through his entire adjustment. It's super gentle. There's no twisting, nothing like that, and it's very low force. So babies don't have hard ossified bones in their vertebrae like we do. They're mostly made up of cartilage, and all it takes is very gentle pressure in the right place at the right time. So in order to find somebody that is trained to adjust pediatrics, I'd recommend 2 resources. One of them is ICPA4kids.org. It's the International Chiropractic Pediatric Association. And so they can give you a list of providers in your area that are members, and those that have gotten their diplomate and are certified in different areas. And the other one is the National Wellness Foundation.org. They have another program too called Epic Pediatrics, and they can show you people that are certified in that as well. But as soon as you have any inkling that your baby might have suffered spinal trauma, I'd say it doesn't hurt knowing. Like, the chiropractor will be honest with you and tell you if we can help you. And if we can't, we'll give you a resource of somebody that can.
So how I usually end all my interviews is I ask them this question. If you could have a billboard made today where you could share a tip with moms everywhere, what would you have it say?
It's a tough one because we covered a lot today. And so I want moms to have all of that information. But I think what it really comes down to is trust yourself and trust your instincts. So I would have it say probably one of those 2 things. Because I do think moms and pregnant women and women in general tend to be dismissed. And it's like, oh, well, what do you know? Like, this is your first kid. I'm the doctor. I know all of this stuff, and you should listen to me. It's like, if you feel like something is wrong, then like, you are the one living in your body, and you know better than any doctor, and your body knows better than you. Like, your body has gotten you up until this point in your life. So like, trust yourself and trust your instincts. And so I think just bringing back the empowerment piece is huge in normalizing pregnancy, normalizing labor and delivery, and growing healthy kids at the end of the day. But I would have a little asterisk in the corner that says get adjusted all throughout pregnancy.
And then for everyone watching, I know you gave some awesome resources earlier, so I'm going to make sure to put those like in the description of where they can find a chiropractor near them for pediatrics. But where can everyone follow you on social, get more information from you?
Yeah, so again, I am in Austin, Texas, and I am most active on Instagram. So my Instagram is @PeapodFamilyChiro.
Well, thanks so much for sitting down with us today and answering all our questions. I think this was a super important one to have because, like I said, you're the first chiropractor. So first, like, holistic approach to a lot of the issues that we do see in the world today. So I think that's awesome. And thank you everyone for watching. Again, I'm Krista from Mommy Knows Best. And please check out our Facebook group called Mommy Knows Best Judgment Free Mom Tribe.